Diabetes, it's very simple. So don't worry about it. The problem with diabetes is if you do not address it, the problem with that is you will have complications. So, Mariel, diabetic, please help me. Well, diabetes, I have discussed this condition for several videos already. And I already told the people that if you're diabetic, it's a lifestyle disease. So, you really have to change your lifestyle. And of course, you have to take chromium, magnesium, okay, zinc, even zinc, you can take zinc. Molybdenum. So these are just the minerals that you can take if you're diabetic. For the plants, insulin plant, serpentina plant, just if you can eat them, that's good. If not, you can just drink them. So drink it 3 times a day. And of course, exercise, you know, they're very important. It improves your glucose inside the body. Okay? Apple cider vinegar also, very good for diabetic people. Yes! Yes! What can you do to clear for the eyes, diabetic retinopathy? Of course, you have to address the diabetes. Okay, always, that's the first thing to do. You have to address it. You have to make the dietary changes like what I said. And the one that can really help you is Eye Bright. It's a plant, okay? You can also eat it, and you can also put it as a drops in your eye. So if you're interested in that plant, it's called Eye Bright. So look at it. In the Google, it's very easy right now. So you can see the plans. And if you're still not sure, just private message me and I will help you find it. Diabetes, it's very simple. So don't worry about it. The problem with diabetes is if you do not address it, the problem with that is you will have complications. You will have complications in the kidneys. So you can have CKD, chronic kidney disease. You can have peripheral neuropathy because you cannot feel your hands and your feet anymore, your heart and your brain. So you can have stroke, especially in the eyes. You have diabetic retinopathy, so you can go blind. Okay? So that's why you have to take care of your health, all of you, especially those that are diabetic. And if you're diabetic, it is a well-known science that your blood has a lot of sugar. Of course, diabetic ka nga, di ba? So it's highly inflammatory and it can lead to several diseases as well. So it can also lead to cancer. Okay, so what is a natural medicine for diabetes? Again, serpentina, insulin plant, and of course, you really have to change your diet. Ano? There's really no way, there's no shortcut. There's no shortcut with health, okay? Hindi pwede na mag-iinom ka lang ng mga synthetic medicines. No, there's no shortcut. It is a lifestyle disease.
Ashwagandha. And
if you have a lifestyle disease, the only way that you can treat this is through changing your lifestyle. Hindi po pwede na isa-shortcut niya, iinom na lang ako ng serpentina, ng insulin plant. No, it's not gonna happen. Okay, so if you're gonna take Boston C right now, so you have to wait 1 hour to take the vitamin C, or you have to take another hour to take your Pixie dust. Okay, so do not take them all at the same time. Okay, so what is the suggestion for diabetes and doing dialysis 2 times a day? Now for diabetes, again, you have to change your diet. Okay, hindi po kayo, this is what I always tell them, you know, when I was in Phil, I was consulting with patients. I always tell them, it's like, you have to see sugar at a different angle. Okay, you see it, it's like you're allergic to sugar. So, kailangan talaga yun ang iniisip mo. So, do not touch it, do not take it. Eh, huwag nyo na masyadong tinitingnan. Sabi ko nga sa kanila, so, because that's the primary cause, that's a culprit, ano? So, do not take a lot of sugar if you're diabetic. And chromium can help, chromium. And also, again, serpentina, insulin plant, and magnesium can help. Now, for the dialysis, okay, I do not advise anyone to stop their dialysis, okay? You decide. Hindi po ko magde-decide. I'm not gonna be the one to decide it for you, but you You yourself will decide if you want to stop it. Now, if you ask me, Doctora, do you know anyone who stopped doing the dialysis? Yes, I know a lot of friends who have stopped doing their dialysis, but I do not advise it, okay? You decide for your own, okay? So, that's it. And then you take for the dialysis, for CKD, baking soda, again, 1 teaspoon 3 times a day. Well, diabetes, you have type 1, of course, and you have your type 2. Ano? For the type 1, they usually give you insulin. It's your insulin is low to 0. And for type 2, you have your insulin resistance na tinatawag. I mean, the cell, there's insulin, either hindi masyado maganda, poor quality yung insulin ninyo, or you have decreased sensitivity of the cells, so yung tinatawag natin insulin resistance. Okay, so yung cell mo, nandyan yung insulin, di naman niya pinapansin. Ano. Now, the most common herbal medication that they usually use is serpentina, the ones that are very, very bitter. Ano mo, Momordica charantia, which is your bitter herbs, okay, your bitter foods. That's the ones that you don't like.
Bitter gourd?
Yeah, the bitter gourd, ba? Okay, so that's good for you. And of course, chromium. Ano? The chromium is a part of your IGT, your not IGT. Yeah, not GTC. It's glucose tolerance factor. GTF, yun pala. So it's part of your glucose tolerance factor, your chromium with insulin and then glucose. It will enter into the cell, okay? Magnesium also. Magnesium, zinc, and sulfur. Ayan, lalo na yung sulfur kasi that's part of the insulin, the chemical component, yung structure ng insulin. Part of that is your zinc and your sulfur. So pag tinignan mo yan, meron silang sulfur and zinc. So it's better also to eat foods that are rich in sulfur and zinc. Okay? Especially magnesium yan. Talaga maganda talaga yan. So this is my substitute for my magic oil. Diba? And magnesium, we all know that's very, very good for hypertension, diabetes. It can help with seizure disorder. So yung mga laging pagod, may anxiety disorder. Now, why is this better? A better product. Okay? This is a better product because the magic oil, diba kaliit-liit lang nun? Okay, because the magic oil, back then, honey, they're very, very small.
Very small.
So this one,
and very short shelf life.
Yeah. Yeah,
very
short.
Very
yeah.
effective, but again, a very short shelf life.
Okay, so this is around 7 ounce. So 7 ounce siya with 166 servings per container. So how much is this?
How many servings?
No, how much? $45.
This is $45.
Yeah, and it will last you 6 months. Diba? 6 months. Kaya wag na kayong magalit.
Or less, depending upon your issue.
Yeah, 6 months or less, depending on your issue.
So you should always consult.
You wait. Sure. The magic oil actually would last only 1 month to 3 months. 1 month lang nga yun yung ganyang kaliit. So this one, it's pure. This is pure because the ones in fill, I have to put them in water. So this, majority of them, they're actually an active component. So this is a better product.
No fillers.
It has no fillers.
No fillers of any kind.
Yes. So that's the most important because everyone kept asking me, honey, like, Dr. Farrah, why is Dr. Farrah brand a better brand than everything else? Because of the fillers.
No, we don't believe in fillers. I mean, the thing is what you have to look at. Like, for example, you're going to discuss the megadose vitamin C. When most folks are getting a vitamin C product, you're getting let's say, taking a 500 milligram pill or caplet. And when you actually analyze how much 500 milligrams is, it's not very much. I mean, it's a little more than a pinch. And when you see these gigantic horse pills of 500 milligrams, it makes you wonder what the heck else is in there.
I know.
That what the heck else is in there is all fillers. We don't believe in fillers.
Okay. So next is your megadose vitamin C. Okay. So the megadose vitamin C here. Yeah. Megadose vitamin C is a better vitamin C. Why? So again, the packaging is a lot better. Okay? And it's a more concentrated and more potent vitamin C. Okay? So, nandiyan din po yung serving nila. Serving. So, yung nakalagay po sa mga serving, these are just recommended or suggested use. Okay? Especially to some of my clients, back then, you know, some of my patients when I left the country, some of them, I would give them high doses of vitamin C. So, you can
Therapeutic
always,
doses.
yeah, you can always ask me. Ano ho ba? Okay. So,